For the examination of nose, first we have to inspect the interior and inferior surface of the nose. By gentle pressure on the tip of the nose with your thumb usually widens the nostrils. Use a pen light to obtain a partial view of each nasal vestibule. Note the tenderness of the nasal tip and asymmetry or deformity of the nose. Now test for nasal obstruction. Ask the patient to breathe in by pressing on each ala nasi in turns. Inspect the inside of the nose with an otoscope. I am using my pen light as an otoscope. Tilt the patient's head back a bit and insert the otoscope. Avoid contact with the sensitive nasal septum. Hold an otoscope handle and try to see the inferior and the middle terminates, the nasal septum, and the narrow nasal passage between them. Now, sinuses. There are four sinuses: maxillary, ethmoid, frontal, sphenoid sinuses. Palpation of the sinuses. I have to ask the patient to tell when it pains. Now press on the frontal and maxillary sinus and check for the tenderness, nasal discharge, heaviness, fever, or any pain. For transillumination, I have to dark the room and I have to use my pen light over the frontal sinus and maxillary sinus. As you see, the transillumination over the frontal sinus. Now on the maxillary sinus. Now for the examination of mouth. First, inspect the patient's lips, color, moisture, crackling or scaling, oral mucosa, gums and teeth, roof of the mouth, tongue, and floor of the mouth. For the inspection of tongue, ask the patient to put out his tongue. Inspect for symmetry. Note the color and texture of the dorsum of the tongue. For the inspection of pharynx, inspect the soft palate, tonsillar pillar, uvula. Press the tongue blade firmly down the midpoint of the arched tongue, back far enough to visualize pharynx, but not so far that causing gagging. Note for the exudate, redness, and swelling. Now for the neck examination, tell your patient that you're going to examine his neck. Upon inspection, there is no visible masses or scar, and it looks symmetrically aligned. Now ask your patient to tell if it pains. There is no lump and tenderness upon palpation. Now tell your patient that you're going to palpate his lymph node. For this, you have to stand behind your patient. Now palpate the 10 lymph node regions. First preocular, second posterior ocular, third occipital, fourth tonsillar, fifth submandibular, sixth submental, seventh superficial cervical, eighth posterior cervical, ninth deep cervical chain, and 10th supraclavicular. Ask a patient to please flex his neck slightly forward to relax the SCM. Stand behind the patient and palpate the thyroid gland. There is no nodule or tenderness noted and thyroid is not enlarged. So upon inspection, there is no tracheal deviation. Trachea is in the middle upon checking using finger along one side of the trachea and note the space between it and SCM. Compared to the other side, the space should be symmetric. Now ask your patient to swallow some water. Watch for the contour and symmetry of the thyroid gland, and it should rise with swallowing together with thyroid and cricoid cartilage.